People with chronic NTDs require long-term care even after cure. Primary healthcare system is often their only option. But even in high endemic areas, resource-constrained health systems consistently overlook NTD care. People, however, cannot wait for services which directly impact their health and socio-economic situations. There is an urgency for evidence based action. We show how relevant and reliable data collected by the people impacted is being used by them for them to bring about the needed interventions and measurable changes. Without altering the fundamental makeup of primary healthcare services, we are making it possible to extend the ecosystem digitally, providing equitable and integrated primary healthcare at home to all. ALM, LEPRA, HRL, IIPH Hyderabad, and PHFI are collaborating in a 3-year NTD and WASH program called Jagruti. In year 1, 160 local women were trained to conduct digital surveys for NTDs and WASH. Most of these women had never used a smartphone before. They were trained to screen for NTD diseases, WASH determinants, provide home based care, and WASH education in real time as guided by the digital app. For the first time, comprehensive, granular, geotagged, and photographic universal data of nearly 80,000 households with about half a million people was collected by trained local women in their own villages in a very short time. The data and intelligence from the data for the Jagrati project was collated and provided by a digital application called Comprehensive. Comprehensive is an Android smartphone based application that can screen and in real time manage several disease conditions across different socio-demographic, economic, WASH, nutrition, and disability categories. Comprehensive has innovative, language neutral, icon and image based intelligent screening software that can be used by any trained field worker with limited literacy anywhere in the world. Based on the screening, Comprehensive guides the user in real time to customized short health promotion animated videos, diagnostic, treatment, and referral advice. Comprehensive is designed to be infinitely customizable with modifiable questions, response options, and interventions to accommodate localization and diverse requirements. Comprehensive is 10 times faster than comparable paper based tools, collects high quality GPS tagged images with metadata, provides screening and interventions across multiple conditions, provides real time customized service. It has 3 times faster training time since literacy status is not a constraint. 85% of medical experts concur with the assessments made by Comprehensive. Comprehensive, used by training local women, have identified and reported more than 5,000 cases of leprosy and LF. This data was previously unknown to the health systems. Real time data analysis resulted in home based care for more than 1,000 people with severe leprosy and LF disability. The application guided the trained women to give specific exercises, care, and advice during regular home visits. As a result of the home visits, in year 3, we have documented evidence of outcomes. 67% of 63,630 households are practicing recommended WASH behavior. Ulcers decreased in 94% of recurrent leprosy plantar ulcer cases. Entry points healed in 94% of LF cases. Acute attack episodes decreased in 93% of LF cases. Limb swelling reduced in 73% of LF lymphedema cases. The data was shared with government authorities for evidence based advocacy, collaborative planning, and implementation of relevant interventions. A weekly NTD clinic was started in the Community Health Center at Kalyanpur in India in January this year, which has already benefited around 500 patients with chronic NTDs. 446 out of 1,944 men identified, or 22.94%, have had successful hydrocele surgeries. 60,367 households out of 63,630, or 95%, now have piped water. This was 36% at project start. 7,650 households are now connected to the drainage system. 1,140 out of 9,829 households, or 12%, without toilets have new constructed toilets. In Nepal, local municipal authorities were invited for a mirror visit to see the actual situation in their municipalities and the data shared with them. Within 2 weeks, two tube wells were installed, benefiting 40 Dalit households who had no previous access to safe water. Open drains are being covered, and several households without drainage have been connected to the drainage system. Reliable data remains the most powerful tool for evidence based action. Looking beyond high level summary or sampled data, action that will benefit people happen when the people most affected by the problems understand and use their data at the point of impact. Comprehensive narrows the gap between surveys and service by sourcing reliable data and understanding for continuous customized action. Our vision is to provide home based, universal primary healthcare in remote areas through trained and empowered local community health workers who can regularly screen every household in their communities for endemic diseases and their determinants using comprehensive. Managing early and chronic stage conditions and their determinants through frequent home visits for objective, customized management while referring acute or late stage conditions for facility based care. Using comprehensive, we estimate that universal primary healthcare provision could rise from 10 to 15% to almost 100%. This would reduce morbidity, mortality, and improve quality of life for disadvantaged populations in resource constrained regions globally, leading to equitable, comprehensive, integrated, and sustainable primary healthcare services for all. Thank you.